I am going to be demonstrating how to administer an ID injection.
Roll.
You want to gather all your supplies. So you will need your MAR, your physician's order, and you will need some alcohol prep pads. You'll need the syringe, the needle, and the actual medication for the PPD. So what you want to do is you want to compare and verify that you have the order and that it's correct. So you want to do the 5 rights, which is the right patient, right drug, right dose, right route, and route. So we have Smith, Clara, and the ID numbers match. It says PPD to be administered 0.1 milliliters intradermal now. And the physician's order says require the PPD ID skin test. So they match. You want to make sure that there's no allergies. So the patient's actually allergic to morphine, so that doesn't actually interfere with the PPD. So now you want to go ahead and sign your MAR. So you put the date and your initials. And then later you go back and put the site, the exact site where you administered the medication. So now you open your med cart. Okay, I'm going to perform hand hygiene. Okay, you want to make sure you get your right syringe. So this is a tuberculin syringe, 25 gauge, 5/8 inch of the needle. You need an alcohol swab. And then you get your PPD solution, so you just make sure that it is a PPD solution. You check the expiration date and make sure it's for the right patient. So once again, this is Smith, Clara, and it's the PPD, and it's going to be 0.1 milliliters. And we're going to give it intradermal, and the time will be right now when I get it prepared. So you get your alcohol pad. You want to wipe the vial inward from center outward. You can leave the alcohol pad on top. You open your syringe. You want to draw up the amount, so it's going to be 0.1. 0.1. Go ahead, take this off. You push the air in, flip it over, and without touching the middle part, you draw up. Make sure you don't have any air bubbles in, so you can draw up further down, get all your air bubbles out. Some you really have to hit. And there it is, 0.1. The syringe you could just pull up and it's ready. So second check would be, again, the right patient, Smith, Clara, the right drug, which is a PPD, the right dose, which is 0.1 milliliters, and the route would be intradermal, and the time will be right now. You want to throw all your supplies away. And before you leave the cart, you want to make sure you lock your cart. And you're going to bring your MAR in with you. You're going to bring the medication. You're going to take another alcohol pad. Lock part. And we go to the patient's room.
Yeah.
So now I'm in the patient's room. You're gonna knock. Introduce yourself. Hi, my name is Janet, and I'm going to be your nurse, and I'm going to administer your PPD test. Wash my hands, so. You want to verify you have the right patient. So can you please verify your name?
Sure. It's Clark Smith, and my date of birth is 11/7/65.
Okay, thank you.
Hmm?
And I see you're allergic to morphine. Do you know that you're allergic to morphine?
Yes, I do.
Okay. So today you're gonna put gloves on. Look at your MAR again. Make sure you have the right patient, the right drug, which is the PPD. You have 0.1 milliliters. And you're gonna do an intradermal. So now you wanna inspect the site. So the ID goes in the forearm, and you wanna make sure that it's nice and clean. And right here, perfect right here. So what you wanna do is get your alcohol swab. You're gonna clean inner to outer. Now you wanna do the skin taut just a little bit. The ID, you wanna do it at a 10 to 15 degree angle. And you wanna make sure that the bevel of the needle is facing up. Okay, so now you go ahead and tell him you're gonna feel a little pinch. You push it in just as soon as you can't see the bevel. And then you go ahead and just watch until you see a little wheel. When you draw it out, you wanna make sure you keep your 10 to 15 degree angle. Safety, one hand. And then you twist. And then you want to mark it with a pen or marker, the area around. And you want to take off your gloves. Do hand hygiene again. And ask the patient if there's anything else that they need. Do you need anything else?
No, I'm okay. Thank you.
Okay, I will be back and we will check on your PPD in 2 days.
Okay.
Okay.
Go.
So last thing you want to do is come to your MAR once again and put the site that you administered your injection in. So there's codes on the top of the MAR, and you will just select which one you did. So I did the left arm, so LA, and then just always remember to provide privacy for any type of skill or patient care that you are doing.